The materials needed are a full arch prosthetic that is designed on multi-unit abutments and multi-unit abutment analogs that are compatible with the implant system. The first step is to remove the prosthetic from the patient. Then, carefully clean with a toothbrush or an ultrasonic around each implant site. They must be completely free of any debris in order to ensure that the analogs fit perfectly into each site. The next step is to flask. This can be accomplished with either a laboratory flask or even a denture cup or a retainer cup. The important thing is that the height of the overall prosthetic with the analogs fits inside the flasking device. The next step is to fill one side of the flask with stone. It is very important that the stone only comes to the top of the analogs. You do not want to have the prosthetic dropped down into the stone because it could get locked in. The prosthetic was adjusted and rotated slightly, not shown in this video. Once the stone is set, use a lab putty in order to encapsulate the prosthetic. You'll notice in this video that we did use the top and bottom of the flask, although it's not necessary. As long as the flask is completely encapsulating the prosthetic, then the task can still be completed. Well within the setting time, carefully ensure that the putty has touched all parts of the prosthetic. This part is very important because if there are voids, then they'll have to be adjusted and there'll be a little bit of guesswork on the laboratory's end. Once the putty is set, the flask can be separated. At this point, inspect the inside of the flask for any voids. If there are any large visible voids, please repeat the flasking part with the blue putty. Then unscrew all the screws from the prosthetic, remove the prosthetic from the stone. It should separate pretty easily. Return the prosthetic to the patient and send the flask to the laboratory, along with an opposing cast and a bite registration. Also, if there are to be changes made, please capture full face, full smile photographs with the prosthetic seated. The iJig is patent pending. However, it is of course available to doctors looking for a simple, no-hassle method to restoring full arch cases. Contact Roe Dental Laboratory.